Hey everyone, and thank you so much for taking the time today to hear about some promising policy solutions for the devastating maternal mortality rate in Burundi. My name is Eleni.
I'm Lauren.
I'm Sonja.
And we're really hopeful that today our presentation will help you all to realize that a worldwide mobilization of resources to protect some of the world's most vulnerable populations is indeed possible. For those who are unaware, Burundi is the world's second most impoverished nation with the second lowest GDP in the world. Nestled between Rwanda, Tanzania, and the Democratic Republic of Congo, Burundi is a small country in East Africa that has been torn apart in many ways by devastating civil war. After 3 years of being ravaged by violence and racial divisions, Burundi has been left with little in the way of resources and infrastructure. Poor health infrastructure means that many are left exceptionally needy and without access to necessary health resources, making it difficult to address certain critical health problems, contributing to the preventable deaths of thousands. Women's reproductive health in particular has been impacted. Maternal mortality rate, or often known as MMR, is used as a litmus test for population health worldwide because it is so deeply impacted by social determinants of health and the availability of adequate healthcare infrastructure and delivery. However, Burundi has one of the worst MMRs in the world, of about 800 maternal deaths per 100,000 births. The problem is exacerbated by the drive to replenish the population after many devastating wars, leading Burundi to have one of the highest fertility rates in the world as well. There are a myriad of reasons that women are often left unable or unwilling to seek prenatal and postnatal care. Patients are often expected to bear the brunt of payments despite drastic costs, and there is a general lack of staffing and supplies due to broken dispersal services, and transportation is often unreliable. Therefore, women are often unable to receive adequate care. Fear of HIV and social stigma often drive women away from seeking care in the first place. Finally, the influence of the Catholic Church creates stigma against use of contraceptives and general conversations around sexual health, further driving women away from seeking treatment that they desperately need. In light of these facts, we urge the United Nations and other world leaders to take our policy suggestions into account for the future of women and children and of family in Burundi.
We have policy solutions in mind, two in particular that we would like to present, which we believe can help mitigate the drastic need for intervention in Burundi. Many of these have been tested through implementation in other nations or are just baseline healthcare provisions already available in many high-income countries that we believe should be widely available. Before we get started, we want to re-emphasize the importance of community-driven intervention and culturally sensitive and encompassing care. None of these solutions should or can be utilized without the input of community leaders. Understanding community and cultural norms and values not only creates solutions with more longevity, but avoids reinforcing the violence created by the legacies of settler colonialism. First, we propose the implementation of emergency obstetric care clinics, or EMOCs, particularly in central areas between different rural villages. The impact of one of these clinics can be seen in a case study done by Taylor Smith. One EMONC was implemented in a local rural village and was equipped with high standards of streamlined care and protocols, as well as emergency patient transfer services that more efficiently brought patients to clinics. Data collected showed that this clinic was able to help avoid an estimated 74% of deaths in one single rural village. This equates to a theoretical MMR of 208 deaths per 100,000 live births, which easily fits within the WHO's Modern Development Goals. Despite being slightly costly, we believe that the impacts of these clinics, especially since they are utilized to bring care to a wide range of rural areas that are not normally invested in by larger healthcare systems, are essential services to lowering the MMR.
Secondly, for a more long-term solution that more so addresses the root causes of maternal mortality, we advocate for the strengthening of family planning services through increasing funding, education around contraceptives, and greater involvement of males in the family planning process. As giving birth becomes riskier and more complicated as women age, the ability to choose when and how to have children is critical to maternal health care. This includes prenatal and postnatal care and strengthened relationships with family physicians, as well as contraceptive use. These are only two solutions that address different components of maternal health. There are other necessities in terms of addressing health infrastructure generally and the ability to provide efficient and effective care to a population in which the majority survive under the poverty line, including affordability and accessibility. However, at the end of the day, needs specific to maternal mortality are healthcare issues that can and must be addressed. We have already seen what works, and now we just need the funding and support to implement this policy widely. Without immediate intervention, thousands of lives will be lost, despite them being fully preventable. It is our responsibility as a global community to care for those who are in need, especially if we have the knowledge and resources to do so. For this reason, we ask for your full support in implementing these solutions in Burundi to help mothers and their families who are so desperately in need of care.